In inspecting the skin's color, we are inspecting for its color variations. If there are any signs of pallor, cyanosis, jaundice, and etc. Because that may indicate abnormalities on the skin, but as I am assessing the skin of my patient, the skin color is just light to deep brown, which is normal. In assessing the moisture of our patient, we need to remember that moisture on the skin falls and moisture on the axilla is normal, but any signs of excessive dryness and excessive moisture are already abnormal, and we need to take note of that. We are now going to palpate them to assess the skin's moisture and check the skin folds and also here on the unexposed area. Please raise your hand, sir. Please rotate your hand, sir. And put down your arm, sir. Please rotate your hand, sir. And put down your arm. Thank you. Next, we are going to assess the patient's temperature by palpating the skin using the back of our hands. It is more sensitive to temperature, while our palms and fingers have thickened skin and have higher blood flow. Hence, they are less sensitive to temperature. That is why we use the back of our hands. I will be going to put my hands on your face. Sir, is that okay?
Yes. Again.
Thank you, sir. Palpated skin to assess texture. Used to palmar surface of 3 middle fingers to palpate the texture. Can you please raise your hand, sir? Can you please rotate your hand? And put down this in your hand. Can you rotate your arm, sir? And put down your arm. Thank you. To assess the mobility and turgor of the patient's skin, we need to expose the part of the skin just below the clavicle of our patient. In assessing the skin's mobility, we need to lift a fold of skin and note the ease of which lifts up and take not the speed of which the skin returns into place. After pinching the skin to assess turgor, so if the skin returns immediately to normal, that means it's an absence of skin turgor. But if the skin stays pinched for about 3 seconds and more, that means there is a presence of skin turgor. Sir, can I lower your shirt and your lower clavicle just to do the assessment?
Sure.
Next, we are going to inspect any lesions. Sir, can you raise your hand like this, please? Can you rotate your hand, sir? can I raise your cuff, sir? Can lower this hand, sir? Can you rotate your arm, sir? Sir, can I raise your other cuff?
Sure.
You can lower your arms. Thank you. In inspecting, we are trying to see for any signs of bruises, any signs of wounds of insect bites, scratches, or any signs of skin lesions right here. Because we want to know that, because if there is a presence, that means that there are abnormalities on the skin. But as I am inspecting the skin of my client, there are no signs of skin lesions. But if there is, we want to note their size, shape, their color, and also if it is discharged as well. So what are skin lesions? Skin lesions can be primary, like macules and papules. It can also be secondary, like it can be pressure ulcers or fissures. It can also be vascular, like hematoma and angioma. And in the worst case, it can be skin cancer, like malignant melanoma. If you notice any signs of skin cancer, you want to evaluate it using ABCDE patterns. So you want to note asymmetry, borders, color, diameter, and its evaluation. And lastly, for assessing the skin, we need to palpate for edema. So sir, can you raise your foot for me? Thank you, sir. You can lower your foot now. So why do we need to raise his foot? It's about this area, which includes the feet, the ankles, and the legs. So in assessing, we need to palpate it first to locate, to detect the edema, then use our thumb to press down on the skin. If the skin becomes indent, it means there is a sign of edema. But if the skin quickly returns to normal, then there are no signs of edema. Thank you, sir. I am now done assessing your skin. Next, I'm going to access your head, nails. But before that, do you have any clarifications?
So far, none.
So now, we are done assessing the skin of our client. We are now going to assess the patient's hair and nail. First, we are going to assess the head, including the hair and the scalp of our patient. And in going that, we need to do our gloves. Okay, sir. So I just need to wear my gloves for a while. Now, what do we want to look for in the hair and the scalp of our client? We are trying to inspect for general color and condition. Also check if there's any depression in the scalp. We need to separate the hair at 1 inch intervals from the scalp and inspect and then palpate the hair and scalp for cleanliness, dryness or oiliness, nevillations, and even parasites. As I can see, his skull is clean, no signs of any lesions or depression in the skull. Also, his hair is not oily and not dry. Also, there are no signs of parasite in his hair. Sir, can you put your arms like this, please? Okay, put this down, sir. You want to put down your arms? Thank you. In inspecting the nails, we want to note the shape and the nail color. Also, see if there is a presence of clubbing, cyanosis, and any lesions. I am now going to palpate the nails to assess the texture and consistency, noting whether the nail plate is attached to the nail bed. So the next thing we want to assess here is the capillary refill of the nails of our client. In doing that, we need to press the nail tip briefly and watch the color change. If the color quickly returns to normal, that means the nail has a fast refill, which means it is normal. But when you pinch it, it does not quickly return to normal, which means that it has a slow refill, and a slow refill on the capillary is a sign of respiratory or cardiovascular disease that may eventually lead to hypoxia. So, Sir Bernard, we are now done assessing your skin, hair, and nails. I'd like to sum up everything that I've been gathered. Starting from the skin, the color, integrity, moisture, temperature, mobility, and turgor are all normal and no signs of abnormalities. Also, there are no signs of any lesions or edema in your skin. When it comes to your hair and nails, they are normal, with no depression of the skull, no signs of clubbing, and the color are just normal.
Okay, that's good to hear. Thank you.
So do you have any question or you want to clarify some things, Sir Bernard?
None so far. I understand all the things that you have said to me. Thank you.
Okay, Sir Bernard, that would be all. You can go home now and take a rest. And have a good day. And now, we are going to perform hand washing to reduce the transmission of microorganisms, increase patient safely, and decrease healthcare associated infection. After I have done hand washing, I am now going to document the findings in the client record using printed or electronic forms of checklist supplemented by narrative notes.